Seniors, do you have trouble walking as fast or as far as you'd like due to lower back pain? If so, you're not alone. The inability to walk comfortably is a common but frustrating problem among seniors. But today I'm going to share with you some research that sheds light on that problem as well as some solutions. Now, the short version is if you can't walk as fast as you'd like, you probably have weak hips. Now, before we jump into some strengthening exercises for your hips to help you walk longer, I want to share a little backstory on this video. I recently went to a conference with orthopedic manual physical therapists from across the country. And one of the keynote speakers was a leading researcher in the field of lower back pain by the name of Dr. Gregory Hicks. Now, Dr. Hicks has been involved in some landmark studies, but what makes his research agenda really unique is that he focuses on seniors with lower back pain. Now, you may not know this, but a lot of the research in regards to lower back pain isn't widely applicable to seniors because most studies exclude people over the age of 60 to 65 from participating due to possible health complications that may confound their results. And so the results of those studies don't really always apply to seniors because they weren't involved in the study. But Dr. Hicks and his colleagues did a recent study published in 2021 that identified 3 groups of older adults with chronic lower back pain in regards to their ability to walk. They followed 250 older adults with chronic lower back pain over the course of an entire year. And over that time, they tracked both their pain as well as their walking abilities. Then they used some advanced statistical techniques to find from the data what factors were really responsible for the differences in pain and walking abilities. And from their data, they found 3 subgroups of people. And those were people with lower back pain without hip weakness or hip pain, people with lower back pain and hip weakness, but not hip pain, and people who had lower back pain, hip weakness, and hip pain. Now, interestingly, it was the presence of the hip weakness that affected people's ability to walk most, regardless of whether or not they had hip pain. And so it seems prudent that if you want to be able to walk longer, that you want to get your hips stronger. Now, Dr. Hicks and his colleagues did have a follow-up study, which I'll tell you a little bit about later. I want to first jump into some exercises to help you strengthen your hips. So one of the best exercises to help strengthen your hips in regards to walking is just standing on one leg. Because when you're walking, really what you're doing is standing on one leg over and over and over again. And furthermore, the ability to balance on one leg helps reduce your risk for falling while you're walking, which is another major problem in older adults. So practice standing on one leg. If you need to, hold on to something. If your balance is bad, you're going to be more steady standing on one leg and holding on with the opposite hand, just like you would hold a cane in the opposite hand. And then as your balance improves, you can let up on how much pressure you're using on the chair or other piece of furniture until you can stand without any support. Now, if this gets too easy for you, you can further strengthen your hip by doing kicks while standing on one leg. You can do that just with your leg, or you can attach a resistance band to something and then kick back and forth. But really, even if you use a resistance band, it's the leg that's supporting your body weight that's doing much more work than the leg that's actually kicking. So realize that both legs are working in this case, but it's the one that you're standing on that's really getting the work out. Now, next step, if that is too easy for you, then just doing little mini squats, kind of like when you're going downstairs, is another step to help you strengthen your legs. So those are 3 hip strengthening exercises. Now, furthermore, doing squats or sit to stands from a chair, either mini squats or squats all the way down to the chair and back up is both functional, one, to help you get up out of a chair and start walking, but also to strengthen your gluteus maximus. The one-legged standing works more on your gluteus medius and gluteus minimus, your side hip muscles, but the chair sit to stands work more on your butt muscles, the gluteus maximus in the back. Now this is a quad exercise too for your thighs, and the more forwards you make your knees go, or the more towards your toes your weight goes, the more of a quad exercise this becomes. The more you sit back on your heels and reach back for the chair, the more it strengthens your glute muscles or your hip muscles, which again, these are the ones that are most related to people's ability or inability to walk fast. And so those are a couple options. Now another option that strengthens all three muscles is doing lunges or partial lunges. This is also helpful if you have trouble, say, getting up from the floor. Helps you to strengthen both your gluteus maximus. And remember, putting the weight more through your heel will work the butt muscles more, or just partial lunges if you can't get down all the way. The more towards the toes you go, the more it works your thigh muscles, which are also important, but not as relevant in the case of your walking abilities. Now, additionally, the lunges also help strengthen your gluteus medius and gluteus minimus. So they help with the side-to-side stability of your leg by controlling where your knee is with respect to your hip and your toes. And so lunges or partial lunges are a great hip strengthening exercise to work all three of your hip muscles. Now I've got further videos that give you a little bit more detail into those exercises, but those were just some examples of hip strengthening exercises that you can do. Because again, remember, it was hip weakness that was most highly related to older adults with chronic lower back pain and their ability to walk fast. Now, I did mention before that Dr. Hicks and his colleagues had done a follow-up study, and the results of that have not been published, but they did kind of give some preliminary results at the conference that I attended. Now, the study was studying the combination of hip strengthening exercises along with hands-on manual physical therapy techniques, where your therapist mobilizes or stretches your hip in addition to you doing exercises. And so if you've been doing hip strengthening exercises and you're still having back pain and walking difficulties, or you've been going to physical therapy but just doing some hip strengthening exercises, adding in some joint mobilizations of your hip may be something that could be helpful. And so I would recommend, if you're still having trouble walking after doing hip strengthening exercises, that you connect with a manual physical therapist in your area. And if you happen to be in the St. Louis area, we'd be happy to help you out here at More for Life. And regardless of where you're watching this from, if you found this video helpful, give it a like and share it with someone else you may know who may also be having difficulty walking. Thanks for watching, and I'll see you in the next video.